and I want to welcome our two wonderful ladies right here. The first is Dr. Debra Brammer. She is a naturopathic doctor and specializes in women's medicine. And then the second is Dr. Weiyi Ding, and she is a medical doctor and acupuncturist, and she was actually named one of the top doctors for women by Seattle Magazine. So without further ado, I'm going to welcome up Dr. Brammer first, I believe.
Yeah.
Okay, let's give her a warm welcome.
So I am happy to give this talk because this is something that not only do I personally deal with or have dealt with, let's put it that way, I'm getting much older now, and, but every woman in my practice goes through this. And so I've worked with women for 20 plus years now and been through this with so many different people. And I will say the number one thing you have to have when you're dealing with this is a sense of humor. Because truly, it will test your sense of humor, and so much of it is utterly ridiculous. It just is. You're dealing with dichotomies on a daily basis. And I find that fairly entertaining, but I have an odd sense of humor as well. So I call this dancing through puberty backwards because in a way that's what we're doing. When we were young women and starting to go through the pubertal changes, we were so caught in the grip we couldn't see ourselves. But now we're older and we've developed a sense of self, and we have this ability to observe as we go through it. And and as Ginger Rogers said, she does the same thing Fred Astaire does, but she does it dancing backwards and in high heels. So I think that that's a good analogy. So menopause comes from the Greek. Greeks give us so many words, but what it means is monthly pause, which is interesting, but not necessarily helpful. But it occurs anytime between 35 and 58 or even 60 these days. The average age for it to occur is 47 to 52. That's where the sort of peak of the bell curve is. And what it is the cessation of menses for a year. What happens as you go into it and come out of it is this 10-year span or more of shifts and changes in the way your whole body works. And we'll talk a little bit about some of that. So some women go through it and have little to no problem, which is great. Genetically, and maybe their life is set up in such a way that it's supported them so that their biochemistry can just shift and adapt easily. Other people have a really difficult time. Because we are whole beings, it doesn't just involve irregular menses or heavier menses or changes in cycle. It involves every system in your body. So it involves our endocrine system, our digestive system, our immune system, our nervous system for sure, and also, let's see, what have I left out? It's pretty much everything. Head to toe, inside out. Our whole body shifts and changes because our brain is involved, and so the feedback from your brain to the rest of the body is altered, because as we are a system, any part that's not working fully is going to affect every other part of the system. So if you think of it biochemically, if you think of it as in naturopathic medicine, where we look at sort of the constitution or the whole being, we can see the effects and how they play out. There are some increased risk factors for women postmenopausally, but those are not really about not having estrogen. Many of them are set up genetically earlier in our, just from being born, and some from lifestyle choices or those choices that were forced upon us earlier in life. And one of the things we need to do is look at what our risk factors are and then adapt accordingly, because bodies heal and change. And you can reverse a lot, if not most, of the damage and disease that occurs. It takes, and how you do that is there are lots of different options, but we'll get into that a little bit more. Cardiovascular disease is one of the things that we look at most closely because it is the #1 killer of women in this country. And osteoporosis is second, not only because it's also, there's a percentage of us at higher risk, but also because it impacts our freedom and our ability to make choices and to live our lives fully. So weight gain is common and can progress to obesity, which also has other health risks associated with it. So are these really due to menopause? Some of them are really exacerbated by menopause because of the systemic nature of some of the symptoms. So, but some of the foundation was laid down years before any damage occurred. So in my 30s, I found out that any risk for osteoporosis, not only the family risk, but personal risk, was because of choices I made as a teenager and in my 20s and 30s. So some of that can be shifted and reversed by the way I live and what I eat and what I do, but some of it is going to remain with me, but I'll need to work with that. So does this make sense to all of you? Mm-hmm. And it's the same for cardiovascular disease. If you smoke, it is the #1 thing you can do to improve your health. Stopping smoking. Within 6 months of stopping smoking, the damage is starting to reverse. 6 months is all it takes. Within 7 years, most of that damage is gone and done. Your body can reverse so much of the damage. The earlier you stop, the younger you are when you stop, the more quickly the damage is reversed. So things like that. So not to nag, but I do nag about that one. Mm-hmm. It's one of those things that whatever needs to happen to help you be able to quit needs to be arranged for you to do so. Let's see, so lifestyle. But sometimes lifestyle is about exercising and it's about eating. And how can you even have energy to do that if you haven't had a good night's sleep in 6 months or a year and a half or 3 years? So you need to look at the issues and then remove the obstacles to cure, as we call it in homeopathy. What are the obstacles to cure? Well, the obstacle to cure for a lot of things is lack of sleep. Then there's also access to good food. So looking at those factors. The positive symptoms of menopause, you don't have periods anymore, whoa, which is so great. Sometimes I was so happy, and my doctor had me take all the money I spent on feminine care products and everything associated with it and put it in a vacation fund, and I took a menopause vacation. So now I tell all my patients to do that too. It's a great thing to do. Celebrate it. So no more pain, no more heavy bleeding. Mittelschmerz is pain with ovulation, which can be debilitating for some people. And no risk of pregnancy, which is a plus as well. If you've worried about that for years and years and years, 20 plus years of your life, or 30, your rational mind can become clearer. So if you're sleeping, your rational mind can become clearer. It's easier to make decisions because hormones are not up and down and fluctuating throughout the month. So there's a clarity that hasn't been around since childhood, basically, which is interesting. So, and often much more stable mood, pretty stable most of the time, which is great. The less desirable symptoms. And these are the ones that cause the most problems for women. There are more. It was a page and a half of symptoms. So hot flashes, night sweats, vaginal atrophy and painful intercourse, loss of libido, thinning of hair above and below the diaphragm, and insomnia, urinary frequency, urgency, because the atrophy of the tissues from the low estrogen levels can affect even the structure and arrangement of where things are located over time, especially in severe cases. And then the other things I'll add to that are joint pain and sometimes aching. Old injuries come back to haunt you sometimes. Anxiety, irritability, and sort of emotional lability for a while, and that can come and go depending on what's going on. Depression. And the depression can be from a lot of things. We'll talk about that a bit. Memory changes. It was interesting to teach, and to teach botanical medicine and chemistry while I was going through menopause, because I would sometimes just play Jeopardy with my students, and I would give them the answer and make them come up with the question or the topic we were talking about, because I couldn't remember. I knew it like the back of my hand, but it's like the government went in there and just edited parts of my brain. Difficulty concentrating. So if you're working on something, easily being distracted, or having your mind just head off in many different directions all the time. And some of that can be secondary to lack of sleep, but some of it is also just the hormonal shifts and the way it's affecting your brain. So fatigue, which is mostly from the changes in sleep patterns, and then skin changes. So those are the big ones for people, for the most part. We won't go there yet. So talking about the biochemistry of this, and I'm not going to teach biochemistry, but I want to just put something, we have one of these, good, on the board that sort of, this is my attempt at cartoon. So brain up here, thyroid gland here, heart, liver, and pancreas. This is kind of a larger person. Let's see. Kidneys, here, adrenal glands, and down here we'll put our uterus and ovaries. They always look kind of like an alien when I do my cartoon. So uterus and ovaries. So what happens with menopause is pretty simple. The ovaries get tired and they stop producing as much estrogen, progesterone. And then the brain starts yelling at the ovaries and says, give us more, give us more. Well, when the brain's yelling at the ovaries, that has an effect on the other organs. So what happens is brain's yelling at ovaries saying, give us more, give us more. The ovaries are also not sending the feedback they normally send to the kidneys, to the adrenal glands, to the thyroid gland. And the lower brain, the sort of more reptilian brain kicks in and says, we're under stress. I need to produce more stress hormones. And that makes your heart rate increase. You can get some palpitations, be a little nervous all the time. All of that is happening, and then the higher brain is going, wait, I'm getting all this stress hormones, and the adrenal glands are trying to pump things out. The liver's going, hey, I'm taking things apart and putting them together as fast as I can, because the adrenal glands can take DHEA produced from or the liver can take DHEA produced by your adrenal glands and turn it into any hormone your body needs. Can turn it into estrogen, progesterone, testosterone. It's sort of like Tinker Toys. Any of you know what Tinker Toys are? Mm-hmm. Good. So sort of like Tinker Toys, it takes compounds off, puts a different one on, and it goes from this to that to the next thing. But when you're really putting out a lot of stress hormone, the body isn't able to produce as much DHEA. So you get this vicious cycle going that way. Does this make sense? Mm-hmm. And so that and the higher stress hormones affect the ability of the body to relax and calm down and go to sleep at night. And if you do go to sleep, it may not be as restorative. You may not go into as deep a sleep, or you may wake up a lot for whatever reason. The other thing that happens is you can become a little more sensitive to sugars and to not eating food. You may not have an appetite, but when you eat, you may crave things you didn't normally eat. And because of that, you'll eat more carbohydrates, because they help produce compounds in your brain that make you feel calmer and better for the short term. And then your pancreas, the insulin glucose balance in your body can get a little more up and down than it has been before. So all of this is happening at the same time, constantly, every single day, throughout the day. The choices we make can reduce a lot of these symptoms for many people. So is this helpful to go through this sort of what's happening everywhere? Great, because I love this. I think it makes it so much more understandable and manageable if I know what's happening. So, yeah, so all of this is involved. And in the meantime, you're still trying to work your job, take care of your kids, your partners, deal with your life and pressures and stresses. And it's like the insulation is gone from our lives. Our bodies, our minds, our emotions just can't take as much as we did before. And this is one of my favorite parts of menopause. I call it the cleaning out the closets part. And it's about cleaning out your physical, mental, emotional, and spiritual closet. It's time to discard things that don't fit anymore. Does that make sense? Mm-hmm. Yeah. It's, anyway, so when we're looking at menopause for treatment, we can do nothing. Some people do, they just grin and bear it and walk through it and endure it, and, after a few years, things calm down a bit. But life is short, in my opinion, and I think it's wonderful to do something to make you feel better now, and not wait a year or 2 or 3. I just don't think hot flashes should wake you up constantly for more than a few days, or maybe a few months. If you live in Arizona, all summer long, but we don't, which is good. So I do think going to your doctor and talking about, so here I am at this stage in life, what do I need to do to be healthy for the next 5, 10, 15 years? It's a good thing for anybody to do, male, female, anyone. When you hit 50, it's time. It's like that 50,000-mile checkup for your car. They go through the whole thing. And so the thing I look at for everybody is nourishment. The physical, mental, emotional, spiritual nourishment from life. And I think that's really important. If you're talking about food, I think shifting the way you eat a little bit to give yourself food that matches where you are now versus where you were 10 years ago. So yeah, you need protein, you need complex carbohydrates, and you need fats. Everybody needs fats every day. But how much you eat and the types you eat should probably shift and change. It's great to eat a lot more fruit and vegetables during this time. All of them have the antioxidants that help buffer some of the shifts and changes that are occurring in our body. Whole grains are good, but for most people, too much whole grain sedates them and weighs them down. So balancing out the amount of whole grain, where you would have eaten a cup or 2 cups 5 years ago, maybe going to a half a cup would be a better choice. Does that make sense? Just allowing foods that are easily metabolized to come in and out of your body. And making sure you don't skip meals is really important during this time. It can buffer some of that nervous system feedback, that negative feedback that occurs that contributes to anxiety and depression and afternoon fatigue. Yeah, all those things. Breakfast, and then you can do little like tapas through the day, or you can eat 3 meals. I recommend eating a little smaller plate and never going more than 4 hours without a snack of some kind. And I go for healthier snacks because you want to keep that blood sugar stable, because that quiets down the stress hormone release from our reptilian brain, from the sort of lower brain centers. Does this make sense? Yeah. So I sort of go by and everybody's different. You'd want to talk to your physician about this. Like, what should my plate of food look like? What things does my constitution say I should eat a lot of, and what should I avoid? Because your body is going to need what you need, not what everybody else in this room does. So, okay. I just thought you eat with your eyes. So I like color on a plate of food. It makes it much more fun to eat. It's prettier. Pretty's good. And if you're eating a lot of fruits and vegetables, you're going to have the color. So more variety every day. A little of this, a little of that. So protein twice daily. What protein does is helps maintain our muscle mass so that we don't add as much weight. It also contains constituents that support your nervous system, your brain specifically, as well as your immune system. And, muscles. We like that. It's good. So I say the less legs on your protein, the better it is for you as you go through life. So 0 to 2 to 4. Wild game you can think of as a 2-legged, but still, you want less of that than you're getting of the other sources, or at least a balance of those things. And your constitution will tell you. You know when you eat something that just doesn't feel right inside of you. So looking at that is good. And your spiritual beliefs and whatever you desire, your cravings and desires also enter into this. It's good to honor those things and not deny yourself all the time. I don't like getting rigid about food. I think flexibility is good when it comes to yoga and food. And complex carbs are slow burning. They're fuel. The colored, like fruits and vegetables, have so many nutrients in them, vitamins, minerals, antioxidants. They really can help your body shift from an inflammatory to a less inflammatory process. Grains and legumes are also complex carbs, but when you combine the grain and legume together, like corn and beans, you get a complete protein. So you can look at it in terms of both carbohydrate and protein, which makes it doable. You probably all know this already, but in case you don't, I'd like to review it. And fats. So the great fats for us are the liquid fats, the omega-3, 6, and 9 essential fatty acids, the medium chain triglycerides and fatty acids, like a little bit of coconut oil, walnut oil, avocados. All of those are fat. Cheese, unfortunately, in my book, is a fat rather than a protein source. But a little bit of cheese is a great thing if you're dairy tolerant, or goat or sheep. Yeah. So fat depends on what's going on with your body and your risk factors and your digestion. But fat helps it protects all the mucosal surfaces, the external and the internal mucosal surfaces in our body. So inside, from the mouth through the anus, inside the vagina, all of that is still skin. It's just what we call mucosal skin or wet skin. And you need fats to keep all those surfaces flexible. So it's important to get good ones in. And fats can break down and feed your brain as well, which is always good to feed your brain. The other piece of eating food is sharing food with others. And there's this thing that happens when we sit and eat in community, friends and family and people we love. When you cook and eat together, there's these other layers of nourishment that happen. And we all know this. It's why we have every holiday in this country is centered around sharing a lot of food with a lot of people. Okay. And exercise. And so this can be a dirty word sometimes for people because it becomes one more thing you have to do in a day that's already full. But exercise can occur in really short bursts. It can be 10 minutes or 15 minutes at a time, and repeat that 1 or 2 times a day. It can be cumulative. Get one of those ankle pedometers and have it count your steps a day. 10,000 steps a day is the magic number. If you haven't been active, start at 1 or 2 or 3 and gradually increase those numbers. Vary the terrain that you're walking on. Sometimes you want to be on steep hills huffing and puffing, because you get benefit from that as much as from the flats, probably a little more. And we know the reason you can interval train or work out for shorter periods. If you add interval training, you get 3 times the benefit. That short bit of exercise, 3 times the benefit if you add interval. So really hard, relax a little, really hard, relax a little. It demands more of the body works harder in response. And it's good for every aspect of menopause. It's good for reducing hot flashes because it moves the stagnation that contributes to hot flashes. It's good for heart and protecting the cardiovascular system. It's good for digestion. We all know that one. And it's good for insomnia and stress and irritability. I tell you, if I'm at work and I'm getting cranky because it's been 6.5 hours, I've been in meetings or at my desk all day long, I just go out and walk around the block once or twice. It's amazing what that shifts and does for me. And I think it's true for everybody. I'm not extraordinary in that way at all. So exercise. The trick to exercise is find some that you like. What do you like to do? Or if you don't like any of it, what can you tolerate? What can you do to make it more fun? Find yourself a group to go with. So go join a stretching class or a yoga class. I have a patient who had never exercised in a day in her life, and at 45, she started doing water aerobics with this group. She's been doing it for 5 years. They have become her best support for healthy life that she's ever had. Just going and showing up and being embarrassed to be in a bathing suit in a public place and getting in the water and doing her best twice a week, every week. She inspires me, which is why I put the water one in. And then you can pick exercise that appeals to you. If you are a person who likes yoga or Tai Chi, slow, sort of grounding, calming exercise, don't forget that it might be good to walk to and from yoga, or to add some walking sometime in there, where you're getting some cardiovascular benefits as well. Okay? Moving can reduce hot flashes. It's really great. The other thing that I have people do that can reduce hot flashes is contrast showers. It sounds horrible, and at first it's not that great, but you get used to it. And that's doing alternating hot, cold, or if you're just starting, hot, cool, warm, cool showers. And alternating and getting that gasp of cold, which really stimulates circulation and movement and motion through your lymph system and your vascular system. And it can help reduce hot flashes and also calms your brain. Your whole brain shifts when you do that. You feel alert and awake when you get out, but it's a calm alertness rather than being in the hot shower and I'm just repeating my list of what I have to do that day. I don't know if any of you do that, but that's kind of my routine. So adding that into my shower is helpful. Okay? And yeah, so the other thing is, now we're on clean out your closets, which is my favorite. You need to take every piece of clothing you have not worn in the last 1 to 2 years and give it away. If it's something that's really precious, turn it into something else or give it to a child or a relative or a younger person you know who can use it. But you're not going to wear it anymore. It's unlikely that I will ever be back in the size 4 I used to wear. It's just not going to happen. And so it's really lovely to look in my closet and see only clothes I can wear, instead of, oh, this is too small. That does this thing to my head that I'm not really pleased about, where I feel like I'm not enough or less than. So, and I speak about me a lot, but it's every woman I know. This is a problem for many of us, let's put it that way. So clean out your physical closets, and then you have room and space for whatever's new to come in. But you want to clean out your mental closets. What are the habits you've had that probably are not serving you anymore? Is what you're doing feeding your heart and your spirit? Is it adding joy to your life and adding value, or is it a dreaded duty? And if it's a dreaded duty, is it one you have to continue? Can you shift and change the way you do it? Can you let it go? Because shifting and changing the parts of our life that are not working is an important thing to do as we age. And I had patients tell me that for years. And I finally got it one year. And I always love that. Chase them down and tell them they're right. It's good. So, reviewing our choices, letting go of the dreams we didn't fulfill, because we all had them. Or maybe you didn't, but many of us did. But always look at it in terms of what you accomplished that you never dreamed you'd ever be able to do. I didn't do this, but look what I did. Look who I became. Look at this. And get an appreciation for who you are and what you've become. Okay, so let's get past that stuff. And look at where you get joy and spirit and creativity, and make sure there's a little bit of that time for that in your life instead of giving it away, which women are wont to do. So let's treat the symptoms. There are a lot of herbs, and maybe many of you have tried some of these things. And I have bottles of things that are, these are from our dispensary, but there's every health food store, grocery store you go into has a whole section. So clearly people are looking for answers. So I'm going to pass some of these around, and you'll see a lot of the things I'm talking about in there, and some things that I'm not. But you've probably heard of anyway. So we'll just start sending things around and let you look and explore. Great. Here's another one. This here and these there. These I'm going to talk a little bit about. They're great formulas. Okay, so we're going to start with black cohosh. It's probably the best known herb for menopause, but actually it only works for a certain percentage of women. And I tend to use it with women who have depression and body aches. Those are the women it works best for. When you have muscle tension and tightness and sleep disturbances, and maybe you're just exhausted and depressed a little bit. Feel like you're living under a black cloud. This is a really, really good herb. And the trick with herbs is you have to take them a long time. Hi.
Can you use it if you had breast cancer?
So I'm going to talk a little bit about that and what you would and wouldn't use and the forms of things. So that's a great question. When is it contraindicated? So
Did you just say you can use black cohosh a long time?
you have to use it for a long time.
Yeah, okay.
Because with herbs, you don't get effects for about 6 to 12 weeks, depending on the dose and form. It takes a while for them to really build up in your body to where they work. You may start noticing changes after a week to 2 weeks, but really won't know how it's going to fully affect you for at least 2 weeks, if not a month. Does that make sense? These are like concentrated foods. So they're not like drugs where you will feel it within days of starting to take something. It's more about a process. With some of these that are phytoestrogenic, there are questions about whether they're safe to use with women who've had breast cancer or ovarian cancer. I tend, while historically they say it's safe, I just tend to avoid them because there are so many other options. And I'll use a combination of other herbs and work from a different direction. But for most women who have that musculoskeletal aches and pains, muscle tension, that's a good herb. And I am going to be finished in 8 minutes, so you can get started. Okay. Chaste tree berry, also useful, especially if you have skin symptoms along with menopause. Some women start to get acne again. Others will have an outbreak of eczema like they had in childhood. In some of those women, it's good to use some of these herbs that also work on the skin. It can be a little drying, so I don't use it with women who have excessive dryness. Lady's mantle is softer, milder, is safe for women who've had breast cancer. or and it can also work on digestion. So it's very supportive and restorative to the health of the skin inside your body. St. John's wort, you've all heard about it for depression, but actually it's most appropriate for people whose nervous systems are hypersensitized, where it feels like there's no insulation. Everything just affects you, and much more than you think than it should. So depression can be part of that, but it's more about a nervous system out of balance. And it's good for hot flashes in women who have that symptom. Helps you sleep more deeply. And you may want to use it in a tea form or a tincture form or directly. So I think I brought some. Here's lady's mantle. You can open this, smell it, taste it. They all taste like herbs, frankly. But and St. John's wort, and I'm going to get to this one, and we'll send these all around the room. Okay. And we'll talk about that one last. Okay, so I'm going to buzz through the rest of these, so to speak. Siberian ginseng, for women who are exhausted to the point you can't really get through your day with any energy at all, can be really helpful. However, not everybody needs this. If your nervous system is really exhausted, it's too stimulating. So you can get an herb book, you can look things up online, or I recommend seeing somebody, Chinese medicine or a naturopath, who can help you figure out what your constitution needs. Yeah?
Can you repeat again about this one?
Yeah, Siberian ginseng. It's good for women who are exhausted, where it's like you're so exhausted you can't think. You're so exhausted you can't even take care of yourself. If you are one of those people who's not sleeping, you need to take it early in the day. Okay? But it is a stimulating herb, and you can use licorice root instead, which is a little softer. If you have high blood pressure, you can't use this herb. It's just not safe because it can raise your blood pressure a little bit more. But it tastes good, and it's very restorative to the digestive system, supports the immune system, and it's a very harmonious herb, friendly herb. I use hops for sleep a lot, and not necessarily in beer, but but it's great for restoring sleep, mixes well with other herbs that are for sleep restoration and reduces headaches. And this is going to be online. They can put these slides up, so you are welcome to access them online. And motherwort, which is great for heart palpitations and anxiety.
So where do we go to see them online?
Our YouTube channel?
Our
YouTube channel.
Oh, our YouTube channel.
Oh, okay.
Yeah, the Bastyr YouTube channel.
Okay.
Thanks. And white sage, which is great for hot flashes. And I like it as a tea, or else Ruth Tricky says you soak 6 chopped leaves in lemon juice overnight and then drink the juice in the morning. The acid pulls the constituents out. And I mix it with water and then just drink that. I mix it into water and then drink it through the day. And it really reduces hot flashes and that vasomotor that any of you get the redness with your hot flashes, it helps with that. So it's lovely. Red clover, and this is an herb that people who have had breast cancer should not use. It has some phytoestrogens, but it helps to move the energy through your body, and it cools you off on the inside, which is lovely. And it has a lot of nutrients in it. Alfalfa, which is going around. Alfalfa, great for cows. Very mild phytoestrogen for humans, so it can reduce hot flashes as well. Cooling and very nutritive. And ashwagandha, which is, if you are too sensitive for Siberian ginseng or licorice root, this is the herb for you. It's really restorative to nervous system, but it also helps give you energy. I sent a bottle around that's called Serenogen. Serenogen is for people who are wired but tired, and ashwagandha is one of the ingredients. It's just that so exhausted, but you can't sleep because you're just, it's a miracle. It's a Chinese formula, right? Yeah. And jujube is the last herb, and this is also going around in the bottle. You're welcome to take a few drops, put them on your hand and taste it. Tastes like licorice dates, and it is a date. Jujube is an herb that calms your mind, restores your body, and supports digestion and immune health. Love it. And yeah, I already said that, so I hope this was helpful. I know we went through things quickly, and you're welcome to email me, dbrammer@bastyr.edu, if you have questions. It's dbrammer@bastyr.edu. Okay? And you can look at the slides on our YouTube channel and help yourselves to the information. There's some great herb books out there too that can be helpful, but I always think you should come talk to someone. Not necessarily me, but there are lots of good Indies and Chinese medicine herbalists and acupuncturists in this area. Thank you. And I'm going to turn this over to Dr. Ding. There, I logged off. Do you want this on or off? There. Oh, you want it on?
Yeah.
Sorry.
No problem.
Might need to hit the white
Oh,
thing
okay.
again.
Okay.
It's not
Yeah,
on.
That's okay. Yeah.
Sorry.
Okay, no problem. I tried it yesterday. It's working. So why cannot do it? Okay, do this. Here.
There we go.
Okay, all right. All right, thank you. I'm Weiyi Ding, and so before I start, I thank you for Dr. Brammer and lots of information I don't have to say because she covered it all. Okay, so yeah, I just need more focus on the acupuncture and the Chinese herb, which is the TCM, is the traditional Chinese medicine. And how many of you had acupuncture here? Oh, half. Okay. How many had a Chinese herb? Very. Oh, okay. Partial. Okay. So, anyway, and I just would like, it's my pleasure, and introduce the acupuncture and the traditional Chinese medicine treated to the menopause. Basically, we treated the menopause two group of patients. Majority is Mother Nature. 45 years old, 50 years old, and then got a hot flash, night sweating, cannot sleep, Another group is unfortunately had breast cancer and ovary cancer. They are age 35, 30. Okay, they had a total mastectomy. So hot flash, night sweating, stuff. So, and I just want to go over and how and we deal with that and how much we respond. Okay, so the first is would like briefly and introduce to the Chinese medicine several thousand years history and begin and develop with the ancient people struggle against the natural. So example, acupuncture how develop because the old age people and live in the simple, don't have lots of the tacky tools. So they work hard, got lots of injury. Then, hurts, don't know what should do. And then one day, accidentally, they bumped somewhere. Next day, strange, my shoulder pain is getting better. Wow, okay. So, so the person just tell another person, it's very strange. I hurt very much. However, one day accidentally bumped, my shoulder pain is getting better. Another person say, anyway, I'm so hurt. I tried. So, did the purpose hit the same spots the person told him? Wow. Yes, it works. So that was started the acupuncture points. Acupuncture started with that accident, okay, struggle and wisdom. And then the old age they don't have enough food, so they struggle to survive and for the hungry. So 50 people sit together. This is new things. Take the turn, try. If this is make us, not, and hungry. So sometimes people died. Why? Toxic. Okay. Then some. Okay, this tastes good. This not taste good. And then learned. Okay, this is not only for us stomach feel full, also can help us treat the disease. For example, one Chinese herb, it's called the hold the cow, COW seeds. What's happened? That person and have the very bad edema. So he cannot and work as a hard work. So hold the cow to the heel and feed them and ate the glasses. And then the cow and ate the glasses. He just sit around and saying and chewing the weeds. He don't know what that weeds is. However, just not taste too bad. And then his elephant feet is getting better. People say, what's wrong with you? What kind of food you have? Your severe edema is gone. Try, recall. Oh, only thing I different with my family, maybe that weeds. So, hey, that weeds not to kill you. Another edema patient say that, let me try. It works. So, then we found that this herb is for promoting urination and can reduce the edema. So that's said the beginning and with the struggle and with the Mother Nature. Then influenced by the ancient philosophy, you guys all know yin yang, 5 elements. I will show you the picture. Oh, I know that. I have earring like that. Okay, so because that time don't know the anatomy too much, don't know the biochemistry, but everything is yin yang, everything is 5 elements. So the people use that philosophy introduced to the medicine. Then the TCM, Chinese medicine theory, come mainly from the practice and have been continually enriched, expand to the pseudo practice. Several thousand years ago, no HIV and no AIDS. However, right now, people use the acupuncture Chinese herb treated the AIDS and the HIV, integrated medicine, works wonderful. Same as and oncology, same as some other stuff. I would say it's because the used again, then found more and more. Of course, the modern research is real help that you know what's exactly in their herb, what's exactly how the acupuncture works. And then the next things, and we all know that, okay? So this is the yin yang, and at the beginning, very simple. What's yin and the yang? The yang is the heel face to the sun, warm, hot, like a fire. The yin opposite, the shady side of the heel, so cold, okay, dark. So that's the yin yang. So the people developed yin yang is so smart. Yin yang is and contradicted, okay? And one is bright, one is dark. Yin yang is interdependent, so yin with yang, yang with yin. And the yin yang could transformation, so they not put the line is straight, it's put the curve. I can sneak there, yin become yang, yang become yin. So why make a circle? It's yin yang work all the universe. It's the philosophy concept. Okay, so basically try to use the yin yang theory, make the human body, it's what? Like yin and the yang balanced. Then the 5 elements, you see this? Probably not too much. Then like this is popular. Okay, so whichever is the 5 material, it's something like the wood and the fire, earth, and the metal, water. This is inevitable material we have to use for the everyday living. So which all this material is have the generating, control, the balance each other, which introduced to the human body, all these organs have to balance each other. Okay, I don't want to say too much with that. So, and I think, yeah, so then the Chinese medicine 2000 years ago, there is no CT, no X-ray. What do we do? Use the eye. Oh, you look, actually we use every day. Good morning, how are you? You look great. Why you say looks great? Why? You look at the person energetic, clear thinking, and muscle is very fit. Oh, what's wrong with you? You don't look too good. We use every day, okay? So the Chinese medicine inspection whole body, also specific look at the American culture don't like to stick out. This is rude, okay? However, some still work very well. If your turn is very ugly, usually indicated that something is wrong. Okay, I would say some still work. Okay, we use Chinese medicine, still use it every day. Then auscultation, olfaction, auscultation, and that's mean and smelled. We still feel some people smell different. For example, and because I came to this this country, I started over, went to the nursing school and the English. I was the organ transplant nurse at the UW, so I know the people are kidney fail, they have what? Smelled like urine, stuff like that. Okay, so of course, good doctor, I learned, good doctor, they not listen to the report. They will go to the bathroom, look at the bottom, what's the smell, what's the color. Then we say, okay, potential is what? Because they have the experience. So the Chinese medicine doctor also look at the patient's the different bowel movement, smelled, not a purpose smelled, just what's the smell the different to indicate what's the potential the problem. Of course, olfaction, listen the different sound, and the frog throat, that means, you have the cold, some very weak voice, definitely something wrong with you. You are so weak deficiency. Inquiring, we all do universal, ask the questions. Then palpitation, palpate the body, specific the Chinese medicine, palpate the pulse. And the Western medicine still use, okay? Western medicine still use most of the look at if the pulse is regular or irregular and too fast, too slow. The Chinese medicine, they are commonly used in 28 different pulse. Again, some is very matched the Western medicine, some it is not. We still need a lot of research and with that. Okay, so any questions so far? Okay, so the next thing is acupuncture. And acupuncture, same thing, just I said, it's started with accident, struggle, and with the hard work. But in the United States, it's currently about almost about 45 states regulated with the acupuncture. It's legal and do it. So the needle is regulated by the FDA, which have to be is the disposable steroid, disposable needle. Number one, acupuncture is safe. Will not get any communicable disease. And then the needle in your body depends. Some area the needle put in, even you don't feel that. Some area more sensitive, how bad? Like a mosquito bite. So, however, just to give you the, some kinds of touch, what you feel a little bit, okay? And the side effect seemed to me, I did this over 35 years. Most of the common side effect, bruise, which is because under the skin, lots of small blood vessel, we cannot see. When we poke the small blood vessel, cause the bleeding, bleeding cause the bruise. What's the deal? I joked, you got a temporary tattoo. Okay. You could say looks awful, but you will not feel anything about a weak body. Take care. Okay. So the acupuncture and working for so many things. And the majority, number one, something say insurance cover say okay, reduce the pain, but we learned and we have the patients is for the hot flash, night sweating, insomnia, lot kind of stuff. And for the fertility and for supported the chemo and for the digestion issue works wonderful. Then another thing is the Chinese herb. Okay, so the Chinese herb, most of it is the root, bark, and the leaves and the seeds, stuff like that. Believe it or not, you already ate Chinese herb, every individual of you here. You believe or not? I say example, then you say yes. Cinnamon, you had Chinese herb. Ginger, yes. Okay, and that's just walnuts, yes. Is Chinese herb kill you? Of course not kill you. Okay, but Chinese herb still have to do the lots of the research. Okay, so the Chinese herb is complicated. Common use the Chinese herb is 365 Chinese herb. Okay. Yeah, actually, I am the National Chinese Herb Board and the National Board exam and the certification. I'm the chair overall. Look at the National Acupuncture Chinese Herb Board exam. And however, we still, because the bottom line is public safety, and because any medication is okay, that struggle with the get more benefit or less side effect. We try to get a less side effect also and work for the people. And So they could be, the Chinese herb could be just the, I got some sample like the leaves, the bark, this you have to cook it. Also, technology have the granule like a powder, just mix the water, you eat it. Also have the pills, and so very complicated. I would suggest if the person needed the Chinese herb, then self and go to the store and say I pick up this, because try to get the well-trained people and get the right and the Chinese herb. Okay, so the meantime, and I would say in terms of the menopause, and the acupuncture is help people decrease the anxiety, insomnia, hot flash. And but if this is work, great. Why? You don't take any medication, just the needle. Okay. If this is not the work, the second step is what? Get the people and get the Chinese herbs. Chinese herb different as the naturopathic is individual herb. Usually is combined together, and sometimes 6, 8 different herb together, and which is have to according to the different people give the different herb. So for example, and I did have patients at age 36 because started with the appendix cancer, and then with the 1.5 years she had the 3 recurrence. So the last one and was the ovary cancer, and of course she had the total hysterectomy and the bowel resection and the splenectomy, all kinds of stuff. That time I was the nurse at the University of Washington. I was the nurse for her father. Her sister know me, then she said, oh, maybe my sister need to see, because she was very sick and with the chemo, stuff like that. So this person and the acupuncture Chinese herb first helped her went through to the chemotherapy. And she noticed the difference. She was joke to the nurse, are you sure give me the chemo? Not water, because she don't have the nauseous vomiting, stuff like that. And then after the chemo, and then support her went through to the surgery, stuff. And then after that, next things, she realized premenopause start. Hot flash, night sweats. Okay, so then we need the careful, and with her herb, it's the different as the people like the normal condition, 50 years had the menopause, because a certain herb we try to avoid. So anyway, that person did very well, and right now 15 years she is cancer free. Yeah, so that's and it was very good. The case was on the Seattle and the newspaper, and the Cairo 7, even on the CBS Health News, they will come to the Seattle, tape the patients, interview the patients, was on the CBS Health story over world 300 stations and broadcasted. Okay, so. And which my point is what the menopause, just like Dr. Brammer said, it is, and the mild, we don't have to pay too much attention. But some people is really struggle with that and affect our life so much. Then, and because 10 years ago, we were not too many people come to us. Why? And the hormone. Okay, now it's clearly, and from the Western research told us, hormone is a replacement, it's not the safe. Then so many people come to us, and I would say, and the overall alternative medicine is a helper, and the responding, at least I would say 60 to 70% of the people, and is respond. Okay.